Okay, I hope you're in the right place. We're going to talk about platelet-rich plasma for hair loss and facial rejuvenation today. So a little bit of the topics that we're going to discuss is how does this work? And does it work? And is it effective compared to other treatments? And we're going to go through that. It's going to be a brief presentation, but what I like to do is give you an overview, and for a more detailed understanding, I would want you to definitely come in so I could give you a more individualized look at your treatment protocol. Okay, so we're going to start with hair loss, and we're going to discuss that first, and then we'll go into facial rejuvenation. And then, of course, if you guys have any questions or any kind of concerns, or you want more information, I'm going to give you all my information after, and you could reach me and we can have a long discussion about whatever you want to talk about. Okay, so we're going to go ahead into what is PRP. So maybe you've heard it being thrown around online. I know it's become kind of like a fad, but actually it's been around for a very long time, and it's been a treatment that's only gaining popularity now, but it's actually been around for a while. And what it is, it's using your own blood and your growth factors to help rejuvenate certain parts in your body and certain cells in your body. Okay, so our first look into this is for hair loss. So I know that I've had a lot of patients that, especially after, the pandemic, they've been having concerns with hair loss, and just they feel like their hair is not as thick as it used to be. So that can happen a lot from stress. That can happen from, and one of common stressor is viral, but could also be hormonal, and it also can have also nutritional. There's so many reasons for hair loss. So the reason why I like a holistic approach to it. So when you come in as a patient, I want to take your full history and a full understanding of why you are having hair loss, because even though PRP does work for even androgenic hair loss, which is a hormonal hair loss that is very hard to treat, even though it does work for that, if you don't support the body properly, you will not retain that hair growth. So we like to take a complete picture of why you are having this hair loss in the first place. Okay, so how do we go about doing this PRP for your hair? So how it starts, these are kind of pictures of results, but of course each individual person is going to have a different experience, but this is very typical after 6 or 7 treatments of PRP. Okay, and each treatment we would want to have at least 6 weeks in between each treatment, and a minimum of 6 treatments to achieve this kind of growth. So how does PRP work? Okay, so what we do, our step 1 is our blood collection. So I know a lot of people are a little bit wary of getting their blood drawn, but we make it as comfortable as possible. It doesn't, feel like a very sterile kind of setting where, you're going to get your blood drawn in a laboratory. We make it very fun, and it's more, just like calming. We have the nice calm music on, and the nice aesthetics and the nice essential oils. So everything, we'll try to take the fear out of that. But what we do first is we do draw your blood. Okay, and we take it and we put it into a centrifuge. A centrifuge is a machine where it does, kind of takes your blood and separates it into parts. So the bottom part is the red blood cells, where you could see here, just right at the bottom. That's just red blood cells. We don't need that. That's not what we're looking for here. The next layer is the platelet-rich plasma. That's the one that we are really, really looking for right here. And right on top of that is the platelet-poor plasma, and that's just plasma that doesn't have a lot of growth factors. So, you really want to have a skilled person doing this, because a lot of the time people will, if you go into any clinic or any kind of wellness center, they could draw potentially the platelet-poor plasma, which is, that's not, it still will, because you are stimulating the area, but it's not going to do as much, especially for hair growth. We're really looking for that platelet-rich plasma, that layer right in the middle there. So once we go ahead and get that, we draw 6 vials of blood, which, you know, it seems like a lot, but trust me, we make it as comfortable as possible. And we go ahead and get the platelet-rich plasma into the syringes, and then we go ahead and proceed to inject it into the areas here where you are having hair thinning, okay? And I like to describe the feeling. It's not painful. It feels like a lot of pressure. You feel a ton of pressure kind of going down onto you, because we do kind of hit the bone and kind of come back up and insert right there at where we need to insert it. We insert the platelet-rich plasma. So this is not done with a local anesthetic, like the facial rejuvenation. We'll get to that. This one is mildly painful. I wouldn't even say pain. I would say more pressure. So this does not need to have any local anesthetic. Okay. So what are the advantages of doing the PRP as compared to other things? So the thing is with that, has been, the thing that is very fascinating about PRP is that it is effective even for androgenic hair loss. And I don't know if anyone's familiar with androgenic hair loss, but it's happens to males and females, and it happens with, you know, for a lot of reasons, but it's mostly geared by genetics. And it's not something, you know, the topical treatments we do is like minoxidil, or, you know, we could, you know, some other kind of treatments that you'd have to continue with your entire life to keep the hair stimulated. And it's not really treating the cause, right? So a lot of times the cause is that just with aging, we have reduced circulation, okay? And with reduced circulation, you're also having reduced nutrients to the area. So that's another reason why we deep dive into your nutrition in general, because even, like I said before, even if we do stimulate the area with this PRP, if you don't have a follow-up of, you know, proper nutrition and why you are having the hair loss, then really I would say it's not worth your money if you're not going to follow it up with the proper protocol. Okay. So even with androgenic hair loss, they have found that it is effective. So this is something that's very unique, and we have a lot of studies showing this. Actually, if we go back here, these are pictures actually from androgenic hair loss. This is like female patterned, and this is male pattern. And that's not something that it's very hard to achieve results unless you're doing like a hair transplant or something like that. Okay. So another thing, after you have your 6 treatments, usually they're long-term results, and you just need to follow up once or twice a year, you know, just to maintain, as well as doing the rest of your protocol. So whichever reason you are, whether it's hormonal, whether it's nutritional, or whether, you know, there's some kind of other stress factor, if that is being taken care of properly with your naturopathic doctor, then most likely these hair results will be maintained. Okay, so let's talk a little bit about PRP for facial rejuvenation. If you have any questions about facial rejuvenation for hair loss, I'll give you my information, and I'm being contacted. I can go ahead and you know, respond to you as promptly as possible. Okay. So as far as the PRP for facial rejuvenation, what is that? And have you heard of this? So I know that we've been bombarded with you know, beauty treatments and things we don't know if they work or they don't work, or what's the science behind all these things. So many things you've heard of, I'm sure, to help with facial rejuvenation are like Botox, fillers, lasers, things, microdermabrasion, things like that. And they all have their place, but you have to just really know what you are paying for, and if this is something that, you know, that it's going to be worth your money and your investment long term. Okay. So let's look at a little bit of pictures here, and this is very common to results. So I would say that these are much more lasting results, but not dramatic results as compared to Botox and fillers. So in the first picture here, we're looking at PRP that's more surface, and that's kind of the more the PRP that you see, that it's more just kind of scraping off the skin and adding in PRP. That's what we do for acne scarring or acne in general. So that's a different kind of PRP than PRP injections, is what I specialize in. But PRP with facial rejuvenation, that's also very effective for acne and acne scarring, but we can discuss that at another time. But if we look at the picture on the right here, this is very common area that is very difficult to treat with Botox and fillers, is the under eye area. Because fillers, what happens with fillers is that there are some complications, and they could even be very detrimental complications like blindness. I don't want to scare you, but that has happened. And if you look into the literature, that is something that scares people away from doing any kind of filler under the eye. But that's where PRP shines, is that you can get right in there up into the under eye area without any kind of risks. The major risk you'll have is bruising for a week. And that's just, you know, if you have an unskilled injector that sometimes gets into your blood vessel. And but we can try to avoid that as much as possible. It's a very vascular area, so sometimes even if you're great at it, it happens. But that's the most side effect that I've seen would happen, but nothing. And in literature, there's nothing to say that there's anything very potentially dangerous. So this is something very common after at least 6 treatments that you could see. Just if you take a look at the under eye area being treated, that's a great area to treat with PRP. Okay. So like we were talking about is the under eye area. This is what I was discussing previously. Okay, these are a little bit more pictures because this is where PRP shines, even with the darkness under the eye. It's something very hard to treat. But of course, like we discussed before, why you would go to your naturopathic doctor to do this is that you get a complete history and a holistic approach, because dark eyes, I already can tell just looking at this man here that he has certain conditions that are causing these under eyes. So if you are not treating the underlying cause, then you're not gonna have the prolonged results. You'll have results, but we take a very holistic approach here, and we really want to treat the root cause of why this is happening. So these are other examples of just the under eye area. Okay, so what is great about PRP in general is that it's such a low risk procedure and it's so effective. So we are getting to what is actually happening with the skin. So as we age, we lose a lot of collagen. Okay, so if we're losing collagen, and the way that we build collagen is by first stimulating it. We have to stimulate the production, and then we have to actually have the building blocks for the production of the collagen. So if you were just stimulating the production of collagen, you can do that by lasers, you could do that by PRP, you could do that by many other treatments, but you're not don't actually have the building blocks to maintain that production, then you won't have the great results that you see we typically see with PRP. So how that happens is as we age, we get less and less collagen in the skin, and then our skin starts to thin out. And that's when we start seeing wrinkles and fine lines. So what PRP does is gets right under your skin, where we're targeting the fibroblasts that produce the collagen and the elastin. and the fibrin under there, that we want to stimulate those cells. And once they're stimulated, they will want to produce collagen. But we have a lot of other cofactors to help us produce that collagen that we need to also maintain to make sure that, once it's stimulated, the collagen is being produced afterwards. Okay. So that's kind of what we're doing here. And another great thing about PRP is that it's such a low risk of allergic reaction. It's not a high risk, but there are risks to Botox and fillers for allergic reaction, just because there are additives in there that can cause allergic reactions, and it's happened, and there's literature about that as well if you want to look into that. But because you are using your own blood, there's just very, 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 very minimal risk. I can't think of a reason why there would be an allergic reaction, actually. And the great thing about it is, like I said, after the 6 treatments, you need a maintenance of once or twice a year after that, and your results do stay maintained. I mean, I can testify this for myself. We do 3 main areas that I love to do is the 11s, like they say, the 11s area, the under eye area, and the lip area. And this is where, PRP really excels, because the lip area is another area that's very thin skin, and there's not much you could do about that. Yeah, you could put filler, you could do this, but I like to explain to patients why filler is not a great option. I mean, I don't have a lot of qualms about Botox as much as filler, but filler is just a terrible, and in my opinion, option for, for facial rejuvenation, just because what happens if you just think about it, the more you put into that complex filler, like what's going to happen is eventually your elastin and your fibrin meshwork, this is the meshwork in your skin, it's going to start to loosen up. So I can imagine, you can imagine why, that could be problematic as with more filler that you add. So yeah, the great thing about filler and Botox is that it's immediate results, and lip injections, you can go in and you come out of there, you have the results. PRP, it takes a little bit longer. I would say you wake up one day and you see it, and you're like, wow, okay, I see this, and it does. It's much more long term, and it's much more natural looking appearance. So if that's not something you're interested in, I totally, understand that you would want to go more the Botox route and the more filler route, or the lip injections. But this is more of a natural, maintaining what we naturally have. We're not trying, to get the duck lips or to do this, but we just want to maintain the natural health of our skin. Okay. And then, as we discussed before, we have the Botox and the fillers, and these are, the competitors to PRP. And it's very understandable as why you would choose Botox and fillers over, because of course that's just very instant. But here at our clinic, we like to look at the root cause of why things are happening, and this was something that was very interesting to me during my school, is how can we maintain the skin that we have? How can we do that? There's so many topical things we could do, there's so many procedures, but what's the one that actually works? What actually works? And that's what I did a lot of my research on. Okay, so going back to this topic of just comparing, like we have here, it's just, for me, as if I were a patient, this is something that I would look for. I would look for something that's long-term and just safe, because even though, Botox and fillers, they have big companies around them for, doing the studies and having, the safety, and it is generally safe. They are generally safe. I just, for long term, what is going to happen long term with these things, we don't know yet. And that's not anything studies can do right now. That's something that we're going to see long term. But PRP definitely has been around, and it's something that, that has just always been minimal risk. Okay, so like we discussed before, we can, after I've done my research, this is something that I became interested for myself, and I wanted to bring it to my patients. So for me, the conclusion for me is that I I find it superior to Botox and fillers. And that's the only thing that I use actually for, and it's not something that I wouldn't recommend anything else. So some common questions that I get about it is the facial rejuvenation. Does it hurt? Okay, so this is a treatment that we do use topical lidocaine, and I would say for good reason, because I did try to do it without any topical anesthetic, and I will tell you that topical anesthetic, and I will tell you it does hurt. So I would. But with the topical anesthesia, it's very minimal pain. There's still pain, because you are going into the first layer of the skin, and that pain that area is very it's very vascular. So you do feel pain, but you know what? It's not anything different than you would feel when you're putting in a filler or Botox. Okay, and then so like I said, you can go ahead and connect with me. I'm available, pretty much all the time to answer your questions. You can go to my website. There's a contact form there. You can go on my Instagram. I'm available also on DMs. But of course, if you want to get in there securely, just go ahead and make an appointment for a consultation, and I'll be happy to answer more questions and more individualized. The consultation, there's a 15 to 20 minute complimentary consultation. We can discuss everything that you want to discuss, and then of course, if you come in for treatment, we'll go into further detail about everything. But thank you for joining today. And please don't hesitate to reach out to me. And I hope you guys all have a great rest of your day.